Hi everyone, welcome to Asking the Right Questions using scaffolding to promote critical thinking. This is intended to be a nurse educator seminar. My name is Angie Condi and we'll just dive right in. So what is scaffolded questioning? I visualized it as a pyramid. So at the base of the pyramid, we can see that we have the concept of constructivism. So constructivism is a learner-centered, non-linear, iterative process that encourages questioning and reflection as a means for learners to transform their existing knowledge and assimilate new knowledge. Scaffolding questions really connects constructivism to critical thinking as that middle ground where the actual teaching is occurring, the active process. So scaffolding questions, we'll talk about what that looks like and what it is, but essentially it's guided questioning with the teacher's support gradually being withdrawn as the student is progressing in mastery of different cognitive skills. And ultimately, we want to arrive to the development of critical thinking, which is an advanced high-level processing and application of knowledge to contextualize situations. So that is kind of scaffolded questioning in a nutshell. Now that we've identified what scaffolding questions is, we want to also look at why is it relevant and important today. There's three main reasons of its relevance today. One is access to information and technology, where we have such an overload of information in the modern society that we really start to see critical thinking emerging to be able to process that information, understand what is true, what is not true, how the information applies to our everyday situations and to our professional lives. So that is becoming a more emergent as we see so much access to information. We are also seeing an increasing complexity in the healthcare system as a whole. Patients have more comorbidities, healthcare system demand is increasing globally, and staffing shortages are occurring. Scaffolded questioning really does tie into a lot of these different elements, especially with the nurse retention and recruitment opportunities. And then we are also seeing overall a paradigm shift in education where we're moving away from the teacher as authority toward teacher as facilitator. And a lot of this is driven by the contextual factors of the access to information and increasing healthcare complexity. Now that we've identified scaffolding questionings and understand why it is relevant and important, we're going to look at how do we use scaffolded questioning. So it's really a three-step process. We start with preparation, a preparatory phase where we sit down with our student and really understand what are their learner goals and what is their existing knowledge level and experience that they're bringing in. Then we go into asking the questions. So this is the active phase, followed by the feedback and evaluation phase. The feedback and evaluation and asking questions phase are iterative, meaning that we are going back and forth between the two, consistently trying to make sure that the teaching style is effective and working for the student and adjusting as needed. In terms of what questions to ask, that's where we're going to look at this learner actions bucketing of different types of questions. So at the bottom of the slide, you can see that the buckets are arranged based on increasing complexity and higher level thinking. And essentially what the teacher will do is identify which level or which bucket the student is currently starting at in that learning experience. And they're going to try to work the student through that level of bucketing to gain mastery of it and also challenge the student up to the next level of bucketing. And that's going to continue to iteratively happen until the student has ultimately the ideal goal is to reach the final bucket. Now that we've seen how to use scaffolded questioning, we're going to analyze the underlying framework of scaffolded questions. So there's actually three theories, one of which we've already talked about, which is constructivism, but there's also two additional theories that apply to scaffolded questioning. One of them is Patricia Benner's novice to expert theory. And you can see that pictured in this diagram at the top with the red continuum. So we see that nurses go from novice to beginner to competent to proficient and expert, depending on their progressing cognition abilities and experience. And then we also have Bloom's cognitive stages, Bloom's taxonomy. So you can see that pictured in the green continuum. And we go from remembering, understanding, applying, analyzing, evaluating, and creating knowledge. The buckets, the learner action buckets that you saw in the previous slide that we used to apply scaffolded questions actually align directly with Bloom's cognitive stages. So what we're trying to do is get the student to be moving from that novice level or that remembering stage forward into the higher levels of cognition and higher levels of expertise. The novice and remembering phase, really that knowledge is the foundational entry to practice knowledge that students typically acquire through their academic programming. Usually this is acquired through traditional didactic teaching approaches. But as the student moves toward advanced thinking and higher levels of mastery, we really want to gain that learner outcome of critical thinking skills. And in order to do that, we need to apply that scaffolded questioning approach, which is kind of our middle ground in this diagram of knowledge construction. How effective is scaffolded questioning? The outcomes of scaffolded questionings are really aligned with learning goals of nurses achieving proficiency and expertise and higher level cognitive skills. The literature overwhelmingly supports the use of creative constructive teaching strategies to teach clinical reasoning and critical thinking. And there's four main positive outcomes that come out of the literature for nurses when we apply scaffolded teaching. One of them is progressive and evolving critical thinking. So through the scaffolded process of facilitating, followed by withdrawal of support, the educator really is challenging the learner to grow. The learner is also able to develop a framework of thinking and analysis. So teachers are promoting self-directed, lifelong learning skills, and they're exposing learners to elevated ways of thinking that they can take with them to new scenarios and apply independently in their practice. Collaboration, confidence, and satisfaction, really the expert teacher and novice learner, they form a trusting collaborative relationship in scaffolded teaching. So both become engaged in knowledge co-construction, and this is very satisfying for both the learner as well as the teacher. And then ultimately safe and effective patient care. We see that when nurses are more self-confident in decision-making and patient care, quality indicators improve as well. So you may have noticed so far that this presentation has actually been scaffolded according to various questions. So in the first question, when we asked what is scaffolding questions, we were really looking at identifying and defining, which is under the remembering cognitive stage. When we looked at why is scaffolding questions relevant and important, we were looking at understanding it. When we saw how do we use scaffolded questions, we were doing application. When we looked at what is the underlying framework of scaffolded questions, we were analyzing. And then when we saw how effective is scaffolded questions, we were looking at evaluating. And so our next cognitive stage is going to be creating. So in the creation of knowledge stage, we ask, how will you implement scaffolding questions? How will it look in your practice? So one of the beautiful elements of scaffolded questions really is that it can be implemented differently based on different styles and different approaches, but that also does pose a limitation for it because the efficacy of scaffolding approach significantly relies on the teacher's unique style, knowledge, experience, and skills in communication and facilitation. There's three elements to this, one of which is interpretation, so the way that the teacher actually interprets scaffolding approach. There's also the intentionality, and in here falls the cultural responsive teaching as well. So how intentional is the teacher about creating safe environments for the student to be able to learn and grow and challenge and fail and grow again? So that is a limitation as well. And then discernment. So is the teacher able to discern the student's current cognitive level accurately, and can they discern when the student has grown? So that takes a certain type of skill from the teacher's end as well. In terms of barriers of applying scaffolded questioning, we have kind of mentioned its definition, but it is quite an abstract concept and it's so different for everyone based on their interpretation. It does, even in the literature, elude a concrete definition, so that can sometimes be difficult when trying to train individuals on it. We also look at time and context, so it's not appropriate in every single teaching context. It really does depend on time because you do need the time to be able to sit down with your student and get to know them and build that rapport. Teacher to learner ratios might vary, so you might be with a clinical group rather than one-on-one with a student, and that might change the way you are able to apply scaffolded questioning. And then, of course, the challenge to train and support our educators. It's not an intuitive process. Sometimes for some people it does take a great deal of practice to apply scaffolded questioning, and so it can be a challenge to train and find the resources to be able to train staff as well. And so, of course, in this nonlinear co-constructive process of knowledge, we do have to turn the question around to you as well. Do you have any questions for me that I can help further advance your knowledge, or that you can give me some of your experiences and further enhance even my knowledge on scaffolded questioning and other teaching approaches? So thank you all for listening and for participating, and above all, thank you for being teachers. You are truly shaping the next generation, and it is a wonderful thing to give of yourselves. So thank you all for giving that wonderful skill.